Oh, good afternoon, all of you. Today, in last video, we have seen this phenomena of respiration, but today we are talking about a mechanism of breathing. And the first point is inspiration, and second point is expiration. The process of intake or intake is called inspiration because the process intake and outtake, but we are talking intake, and in expiration is outtake. What it is in this process? Air moves from atmospheric to lungs. This process is also known as inhalation. It is an active process of this when air is coming in the alveoli and alveoli sac. So the average rating of breathing is 15 to 18 minutes. First we inhale, then pause, then exhale. Inhale, pause, exhale. Inhale, pause and exhale is the inspiration and expiration. In this process, the diaphragm have an important role, and the intercostal muscles is also have an very important role, that is to be in the suppose it's a diagram of our ribs, and the muscles are to be tightened in this series. It is called intercostal muscles, that to be tied the diaphragm. It is contracted and dilated, contracted and dilated, contracted and relaxation, contraction and relaxation, contraction and relaxation. It is contracted, both are contracted. This one is also contracted and diaphragm is also contracted, diaphragm is also contracted, then at times it is flattened. Then diaphragm is flattened and the thoracic cavity ribs are to be with the full of air, the intercostal muscles to be pushes, and lungs with full of air. So in contraction of diaphragm, enlargement of thoracic cavity, decreasing pressure inside thoracic cavity, filling of air inside the lungs. It is called the inspiration. So it is a very important phenomenon. The air dry and with atmospheric many particles coming, and it is to be filled with. And in some of the times we have seen the adenoids also in the blast of the, and the very narrow tube is to be related with the trachea and to be connected with the mouth and tube. So it is connected with nose and it is connected with the mouth, and that is on the upsides of the adenoids. So what is adenoids have a role? Most of the time we have seen if adenoids enlargement is there, then it means the adenoids are enlarged, and the air will be difficulty to be going inside in the enlargement of adenoids. This will be happen mostly we have seen in kids. For example, if kids are on the nights, they are wake up and choose the different positions of this, then it is we have seen the enlargement of adenoids. The structure of the face and jaw are uncleared. The ages are growing, so when we see the adenoids are enlargements, because of the adenoids enlargement we have seen. So we are talking in this manner, and opposite of this is called expiration. The diaphragm is in this condition, in the relaxation condition. The ribs are in relaxation condition. Thoracic relaxants of diaphragm muscle, decrease in volume of thoracic cavity, increase in the pressure inside the thoracic cavity. That is called the expiration. So inhalation, pause, expiration is the process of our respiratory system, we have seen. And in this we have talking about the trachea, bronchi, bronchus, alveoli, alveoli sac, and capillaries are related to 6000 ml in 6000 ml inside in the inspiration. Lungs are filled with 6 liters in the time of inspiration, 4600 ml expiration, and in the pause condition it is 1400 ml. We have seen 1400 ml. So this is the mechanism of breathing, inspiration, expiration.